Hello, and welcome to the daily briefing on Milwaukee's health and economy, brought to you by the MMAC and the Medical College of Wisconsin. As you can tell, I am not Tim Sheehy. I am Steve Boss, MMAC's Senior Vice President for Public Policy and Government Affairs, and I'm filling in for Tim, who is taking a much-needed day off. I'm joined by my co-host, as always, Dr. John Raymond, President and CEO of the Medical College of Wisconsin. This webcast is powered by the competitive intelligence team at Aurora WDC. On Mondays, Wednesdays, and Thursdays of each week, we bring you a 19-minute fact-filled update on the impact of COVID-19 on our health and economy. As a programming note, we will not be holding a briefing this coming Monday because of the Memorial Day holiday. We hope you all have a wonderful holiday. Just note that there will be no briefing. Thank you all for joining us today. Our guest today, our special guest, will be JELA TRASK, who is the Business and Investment Attraction Director at the Wisconsin Economic Development Corporation. But first, let's get our daily update from Dr. Raymond. Dr. Raymond?
Thanks, Steve, and good afternoon, everyone. We're going to summarize our weekly COVID-19 trends today. We'll go to the first slide to summarize the various indicators of COVID-19 as of today, and I'll run through these quickly. The doubling times for COVID-19 were slightly improved to 17.8 days in Wisconsin and 20.8 days in Milwaukee. The daily growth rates over the last 7 days also were under 5%, but slightly unfavorable at 3% in Wisconsin and 3.4% in Milwaukee. There were 472 positive tests in Wisconsin today out of a new high of 8,938 tests administered. And recall from yesterday, some of those tests may be lagging from the National Guard testing stations in Milwaukee. And there was a 5% positive test rate over the state. There were 183 new positive tests in Milwaukee with an approximately 15% positive rate. Our COVID-19 diagnostic testing capacity continues to grow, up slightly to 14,140. with 53 laboratories currently running COVID-19 diagnostic assays. Now, there are 398 COVID-19 patients hospitalized in Wisconsin today, and that number's crept up over the last week by about 42 patients. 126 of those are in intensive care unit beds, and that's stable. And out of a total of 1,450 ICU beds in Wisconsin, 383 are open and immediately available. ICU and ventilator capacity are stable and adequate, and PPE trends also are stable in both Wisconsin and in Milwaukee. I want to call your attention to the reproductive number. That's stable in Wisconsin at 1.1, but it's moved back unfavorably to 1.3 in Milwaukee. And this is a trend worth watching, especially as we move through and beyond the Memorial Day holiday. And as a reminder, ideally, we'd like to see those reproductive numbers be under 1. Next slide, please. This slide shows trends for COVID-19 positive tests in Wisconsin on the left and Milwaukee on the right. There seems to be a plateau or possibly an upward trend, which of course could in part be due to the increased availability of testing both here and across the state. Next slide, please. I do want to call your attention to the slide. There's a mistake. The graph on the lower left is not the number of deaths in Wisconsin. I apologize for that. But what I would say is, first of all, fortunately, our deaths are much lower in Wisconsin than in many other states, but we are approaching a grim milestone of 500 deaths. And if the correct slide were inserted there on the left, in the left-hand panel, you would see that both in Wisconsin and in Milwaukee, there appears to be a downward trend in deaths. And I'm becoming much more comfortable seeing that downward trend in Milwaukee. And at the end of the day, this is one of our most meaningful metrics that we need to follow. Next slide, please. This slide shows daily trends of tests administered in teal bars and total positive tests in the pink bars. Wisconsin data are shown on the left and Milwaukee on the right. And the black lines show the percent positive tests over the last 2 weeks. And as you can see, Wisconsin seems to have settled in well below a 10% positive rate, with Milwaukee showing considerable day-to-day variability, but typically over 10% positives. Next slide, please. This next slide shows the trajectory of growth of COVID-19 in Milwaukee, as shown in pink, and the rest of the state as shown in teal. And the vertical axis shows the total number of new cases in the last 7 days, and the horizontal axis shows total cases. The data are shown in logarithmic scale to make it easier to detect any downward trends. Now, the plots show that Milwaukee had been doing a bit better than Wisconsin in bending down that curve, but basically the difference is gone. And ideally, we'd like to see both curves take a sharp downward turn in both of these plots. And as it is, these data suggest that we continue to have a relatively stable growth trajectory of COVID-19 cases in Wisconsin and in Milwaukee. Next slide, please. This graph plots the reproductive number over the last several months. And as you know, the reproductive number measures the contagiousness of a disease at any given point in time. And ideally, we want to see that reproductive number be less than 1, because that would suggest the pandemic would be attenuating. So for this graph, I'll call your attention to the blue line, which shows the reproductive numbers for Wisconsin over time, and the tan line, which show the reproductive numbers for Milwaukee over the same period of time. And as you can see, our reproductive numbers settled in at about 1 in early April and remained close to 1 since then. Although we do need to watch what could be the beginnings of unfavorable trend lines, both in Wisconsin and in Milwaukee, and we'll be following these over the next several weeks. Next slide, please. On the last 2 slides, I'd like to just give you some brief pointers about how to stay safe over the upcoming holiday weekend. Remember, COVID-19 is still around us. Now is not the time to let your guard down. So I'd recommend that you follow your guidelines set by your county or your municipality. If you host or attend an event, please make sure that there are 10 or fewer people gathered there. And it's better to gather outdoors than indoors. Bring your own food and beverage and don't share. Space your seating 6 feet apart. And if you have vulnerable guests, ask them to wear face masks, and you should too. Keep your distance and sanitize frequently. And don't pass babies and small children from person to person, because you could pass on COVID-19 that way. Next slide, please. And the final set of suggestions are: don't play contact sports, avoid physical contact like hugs and handshakes. I know that's going to be difficult to do. Disinfect commonly touched surfaces like doorknobs, faucets, and light switches. Have hand sanitizer available, and make sure that guests who are not feeling well either stay home or go home. And again, don't forget your sunscreen, insect repellent. It is tick and mosquito season here. And most of all, be kind, smile, and enjoy yourself. Summer's almost here. So again, I want to thank you for your attention and turn it back over to Steve.
Thank you, Dr. Raymond. Before we turn it over to JELA, I wanted to ask you one question. I'm sure you've been hearing questions about the new CDC guidance that suggested a downgrading of the threat of surface transmission. And I'd like your opinion on that and what that might mean for businesses as they respond to this in terms of their safe operations protocols.
Yeah, great question, Steve. So the CDC recently said that the transmissibility of COVID-19 on surfaces is lower than they thought it was before, and that the most common way of spread is either through droplets or through human touch from one person to another. What I'd say is right now I would still recommend frequent sanitization of touch surfaces in public areas. I don't think that the recommendation has really changed, because they didn't say that you can't get it by touching surfaces that have been exposed to other people's hands or their respiratory droplets. They just said that the most common cause of spread is from the respiratory droplets and touch. Thanks
very much. Now I'd like to bring in JELA. And JELA, you're the key liaison for WEDC's Business Investment and Attraction Division. Why don't you start today by telling us a little bit what that division does? Thanks so much for being our guest.
Sure. You can hear me okay?
Yeah.
Awesome. So this division focuses on business attraction to the state of Wisconsin, leveraging our core industries and other assets that the state has. And we recognize that for business attraction to really work for the state of Wisconsin, it's important to connect those opportunities to our supply chain, to our talent, and to partners around the state. So in my role in particular, I work very closely with our manufacturing partners and really, looking at the small, mid-sized manufacturers that make up the bulk of our supply chain. How can they prepare to look at technology adoption, productivity improvement, and really understanding what OEMs are looking for. So that's where the liaison part comes in.
Great. Most of the time when we talk about PPE, we're thinking about hospitals and healthcare workers, but that's also a big emphasis right now for WEDC. Can you share with us why?
Yeah, absolutely. Very early on, WEDC started working with the State Emergency Ops Center to respond to the healthcare need for PPE. And that was really because we started to hear from manufacturers, from our partners across the state. There was a lot of activity already happening at a community level, local level, where manufacturers were offering to retool their operations to provide PPE from distilleries to sanitizers, to even a very a large ecosystem built around shields using 3D printing. And we said, why not leverage that and try to use a Wisconsin manufacturer to respond to PPE? And as we look at opening and operating safely, we believe that it's really important for businesses to also take this very seriously because it is at the core of consumer confidence, right? So a business can open, but if your consumers aren't coming back because they're nervous or hesitant, then the economy is just not going to recover at the pace that we need it to. So that's why we believe PPE is really important for B2B and B2C operations.
Sure. So what are you seeing right now in terms of demand for PPE from business? What are you hearing? Is there any particular area that's of acute concern or shortage in the manufacturing or the general business sector?
So as far as on the demand side, it's kind of what as you would expect. Retail services, really those that are interfacing with consumers more directly, very much are looking for PPE and are very much interested in trying to find that available in Wisconsin, just because of cost and availability. And there are manufacturing areas. We put together guidelines for specific industry sectors. There's about 15 of them on our website, and each of them provides a guideline for how important PPE is and protective equipment for different operations, depending on the type of business that you are. On the supply side of the equation, that's really where we saw an opportunity to take what is already happening at a local level. We've got M7 that put a site up because there was demand to try to put this supply and demand together. And so we have the Wisconsin Supplier Network that is an online platform that's been around for a few years. And we felt like what better opportunity than to put protective equipment supplies, have a dedicated page up there, put all these manufacturers that have raised their hand and said that they could offer different types of supplies, like I said, from masks to gloves to sanitizers, and make that available as businesses are looking to reopen and operate safely. So that is available on the Wisconsin Supplier Network, and that includes a lot of manufacturers that have either come to us directly or have come through our manufacturing partners or our regional partners like M7.
So I appreciate the subtle plug there for the MMAC's PPE marketplace, and I know we've had a lot of demand for that. If a business in our region here or outside the region wants to take advantage of that statewide network that you guys have set up, how do they go about it? How do they match up? Mechanically, how does that work if I'm a business looking for help from the WEDC site?
Yeah, absolutely. So you simply have to go to www.wisconsinsuppliernetwork.com. And if you're a business that's looking to procure any type of protective equipment, there's a link straight up on the home page. You link to that, and in that set of listings, you have companies that are providing protective equipment. We're making special attention to feature Wisconsin-based manufacturers. We really want to celebrate the ingenuity and frankly the compassion that we're seeing from our manufacturers that are saying, yeah, I can retool some of my lines to answer this call for protective equipment. There are some products that are not as readily available in the state, and so we're going to review some of those products. We've heard that there's some pretty innovative thermometers out there, right? And so we want to be able to connect our businesses with any product that's going to help them operate safely. If you are a business that offers protective equipment, you can go on to the same link, and then right up at the navigation, it says list your company. You go in, list your company, select protective equipment, and then you're featured in that area of the site. So it's pretty simple, 2 steps.
Great, and I think we're going to have Chris put that web address in the chat section of this briefing. So if people didn't catch that as you were giving the web address, I think you can get it there. Just before we open it up to the audience questions, beyond PPE, businesses as they're looking to reopen, what other help do you have for them there at WEDC? Are there any other assistance programs they should be aware of as they're going through this process of reopening?
Yeah, absolutely. As you're probably aware, WEDC has introduced several funding programs, and there's those are listed on the site. There's guidelines I just indicated. We have over 15 different guidelines that we put together with DHS and the other state agency as well as industry, making sure the best practices are reflected. Those are all on the WEDC website, and just over the last week or two, I guess it is, we introduced a live stream every couple of days. You know so well, right, with how often you're having these updates. Information is so important so that we're all clear on either the information that Dr. Raymond is sharing or ways that you could tap into funding, protective equipment, resources, whatever it is that you need. You can go to WEDC.org, and that's WEDC.org/future-forward. So timely information. I even signed up because things are moving so fast that I felt like I needed a little daily update from my own organization on everything that we're working on. So as information is available, you will get daily reminders at that site as well. And I think Chris will post that up there too.
Well, thanks so much, JELA. We'll bring Dr. Raymond back in, and we have a little time, Chris, for any questions that may have come up.
Sure, absolutely. First of all, those links are in the chat session of your screen as a user right now, so I'd encourage you to check those out. We did have a couple of questions. One for Dr. Raymond, a hypothetical situation. If my coworker tested positive and we were both wearing face coverings, should I go seek a test right now, or should I wait to see if I develop symptoms?
Yeah, great question. I think it's going to depend on how frequently and how close you were in contact with the person and for how long. What I would recommend is just talking to the contact tracer from the public health department, and they'll give you the best advice.
JELA, I know that WEDC has put out some great industry-specific guidelines. What are you doing to encourage businesses to follow those, given that there's no legally binding requirement for them to follow them?
Yeah, that's a really good point. That word guideline, right? It's something that we're all trying to see how far we could take guideline and make it a little bit more actionable. And what we're finding is the more information that we can share and couple with the healthcare information that's either coming from Dr. Raymond or from DHS to be able to say this behavior causes this outcome, that's really where we're trying to zero in and really look at this as ultimately being a part of a commitment that we all need to make. Just because a business opens doesn't necessarily mean that the economy is going to come back as actively as it did. It's going to require all of us to feel comfortable participating in the economy, right, to get it back up and running. So we're doing our best to combine that information and try to encourage the type of behavior that has an end goal and isn't just about enforcement, but is about wanting a desired outcome that we all have to buy into.
Great, and perhaps one last question for Dr. Raymond. About the higher, perhaps, or at least plateauing number of cases, but not a larger corresponding, thank goodness, rise in deaths so far. Does that suggest we're now catching milder infections or milder cases with our testing?
Yeah, that's certainly possible. Again, it's really too early for us to know because fortunately our numbers here in Wisconsin compared to other states are still pretty low. So it's hard to draw definitive conclusions when you've got low numbers in really a relatively short period of time. But yeah, that's one possibility.
Great. Thanks to the three of you. Thanks to everybody who asked a question today.
Have a great holiday weekend.
You too, Steve.
Thank you.
Thanks
Have a great
a lot.
weekend.
Bye.
Thank you. Thanks, Dr. Raymond. Bye.